everybody. This is Chris
and Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
Lots of different considerations that are extremely patient dependent when we talk about the use of an orthosis.
Welcome to Petability. I'm your host, Kathy Simons, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hey, Chris, what are we discussing today on Petability?
Well, today on Petability, the topic is to brace or not to brace with Carrie Adrian, who we are welcoming back to the show. We're talking about bracing our animal friends. It may seem simple, right, on the surface. So if you have a body part that's unstable and can benefit from some external support, great. Let's put a brace on it, right? It can only help. Conversely, however, the more you know, the more challenging the issue becomes. It's important to note that bracing can sometimes make a condition worse. So I know for us, Kathy, in veterinary rehabilitation, you're a veterinary technician, nurse, and I'm a physical therapist. Throughout my career, I mean, we've been doing this for 25 years or so now. Orthotics, bracing has seemed very intimidating to me. And I bet there are a lot of veterinary professionals out there, as well as pet owners, that are equally intimidated and questioning, what they should do. How do you move forward? Is a brace indicated or not? So today, with Carrie's help, we're going to be delving into each of the main joints of our canine to discuss what conditions may benefit from bracing those joints, if at all. But before we get into all of that, let me tell you once again about our guest, Carrie Adrian, who I should be calling Dr. Adrian, by the way, but we're friends. She's given us permission to call her Carrie, but no disrespect there. So in terms of her academics, Carrie got a Bachelor of Science in Biology. She has a Master of Physical Therapy and a doctorate in canine biomechanics. A true pioneer in the field of small animal physical rehabilitation, often not accepting what is in an effort to improve care for our animal friends and creating pathways about what could be. She is one of the first physical therapists to carve out a career working with pets. We saw glimpses of her on Emergency Vets on Animal Planet years ago, and that's when I thought, how cool, that's what I want to do. So in addition to that work at Alameda East in Colorado, her work history includes Director of Rehabilitation Services at VCA Animal Hospitals and Veterinary Specialists of Northern Colorado, and consulting in independent research. In 2021, Carrie became owner and founder of Canine IQ, an educational platform creating a path for physical therapists to learn about veterinary physical therapy as an augmentation to or a transition in their career. As the recipient of many honors and awards, I think it is safe to assume that one of the most prestigious honors was being named Veterinary Rehabilitation Therapist of the Year in 2021 from the International Association of Veterinary Rehabilitation and Physical Therapy. Carrie holds many professional memberships, is published in professional journals, written numerous book chapters, and done scientific and professional presentations throughout her storied career, and she isn't done yet. We at Petability interviewed Carrie back in December of 2024. Hard to believe that was a year and a half ago, because her professional path is so fascinating. And this episode is called The Story of a Pioneer in Canine Rehab with Dr. Carolyn Adrian. So Carrie, welcome back to Petability. We're so happy to have you.
Welcome, Carrie.
Thanks, ladies. I can't believe it's been over, a year and a half now, huh? It's hard to believe.
Can you start with telling the audience what is the difference between an orthotic, an orthosis, or a brace? Are those terms interchangeable?
Certainly these terms are related, but I would not say that they are truly interchangeable. When we think about an orthosis, it's really the device itself. We look at a tarsal orthosis or a carpal orthosis. And many tend to use the term orthotic. And then if it's plural, it's more of an orthoses for multiple orthotics. The orthotic is more of an adjective, like an orthotic intervention or an orthotic device. And then a brace, I would say, is more of a lay term, more of a generic term. When we think about some of those proprioceptive knee braces in people, and that's more of a generic term for that kind of a device. It's more proprioceptive. That's more of the focus is for proprioception rather than true support or stabilization or restricting motion at a joint.
Sometimes when you're a client, you don't understand the difference between the word orthotic and the word prosthetic.
And orthosis really protects or supports an injured limb. A prosthetic actually replaces a body part. That's the biggest difference. So when you have an injury, like a knee, for example, we apply an orthosis, a stifle orthosis to support a ruptured cruciate. When you have an amputation of some sort, then we use a prosthetic device to replace that missing limb.
It's so interesting because until this very moment, I did not realize that I have been using the term orthotic erroneously my entire life.
We all have.
Yeah, orthosis and orthotic was the same, but now that makes sense because, I'm looking at the outline here because we try to be prepared for these interviews and such. And the very next question talks about an orthotic device. So you're right. It's an adjective that is describing the device, whereas standing alone, it is an orthosis.
Yep. You
ding
got
dong,
it.
Ding, dong.
Ding, ding, ding. Learn something new every day, right? That's the beauty of this field is we're always learning.
Always. And I think I'm learning things over again at this age. So,
oh, sure.
Right.
Yeah.
I forgot what I learned before. Now it's all new. On that topic, and I know we're going to get into it specifically, and you kind of mentioned it, but what types of conditions are most commonly treated with orthotic devices?
Yeah, there's probably three more specific joints that we use in orthosis for, and that's the stifle, as I mentioned, for cruciate rupture, the tarsus or the ankle, the hock, as well as the carpus or the dog's wrist in the forelimb, if you will. Those are the three primary orthotic devices that we cast for in our canine patients. There are certainly some others that are out there that we can talk about and, sort of a yay or nay on those devices. There's a lot of stuff out there, gang. Just be prepared, be educated as to whether it's beneficial. And as you mentioned, can certainly be more detrimental than good.
When should a clinician begin thinking about orthosis versus surgery?
You're going to hear me probably say it depends a lot in this lecture, and it's certainly on a very, very individualized basis. There's lots of considerations that go into use of an orthotic device in our canine patients, certainly cost has a lot to do with it. If we go back to the knee, the stifle brace, I'm seeing upwards of $5,000-$6,000 for TPLO surgery anymore. And orthotic devices, stifle orthosis, can be upwards of $1,500 plus dollars. So finances certainly play a role, but there's other considerations. If you have an athletic dog that you want to return to sport, I'd lean surgery. If you have a geriatric patient that has no concomitant issues, I would potentially lean towards an orthosis. However, that said, if there's some degenerative, weakness, if you will, in the hind limbs, an orthosis might not be the best choice for that patient. So lots of different considerations that are extremely patient dependent when we talk about the use of an orthosis.
So at this point, Carrie, I think we've set the stage very, very well. Let's start delving into the thoracic limb orthoses that may be beneficial out there for the front legs. Can we start with the shoulder? Shoulder instability can certainly be challenging to manage. And how can orthotic devices play a role in helping those dogs that have shoulder instability?
For the shoulder itself, I would put this under the category of a soft splint or a soft brace, if you will. There's no true high temperature thermoplastic orthotic that I would consider for a canine shoulder. My go-to soft splint or soft brace is a shoulder hobble for MSI or medial shoulder instability. I know there's a lot of controversy in the field whether we should be using these or not. I'm a huge fan as long as these dogs are monitored at minimum on a weekly basis in these shoulder hobbles. Sometimes they can be applied too tight. Sometimes they are too loose. And if they are on for an extended period of time, you will start to see loss of shoulder mobility, scapular mobility in particular. And if you think about the dog's shoulder, they don't have a collarbone. So that leg, that limb, that thoracic or front limb is held on to the body by muscle. If we are limiting the true mobility within that shoulder, over time, we're going to start to see a loss of motion in there, which is why it's extremely important to have those patients who are wearing hobbles for MSI to be monitored at minimum on a weekly basis, and understanding how to progress them out of the hobbles to progress their therapeutic exercise and return to function, as well as return to sport.
So when you're saying monitored, you mean going back to the veterinary professional, physical therapist, rehabber that is following this dog to ensure that they are maintaining appropriate range of motion, not becoming kind of scarred down. I think about back in the human field, so many people get frozen shoulder, and that can happen insidiously. And oftentimes it is following an injury and such. So if folks kind of think about that, like you were just slinged and never got out of that sling, which now we know does not put the shoulder in the best position for healing a lot of times, that the secondary sequelae can actually, be worse than the primary issue. Now, certainly there are times when we want to use a sling, just like we're saying with these hobbles.
Do you have any particular hobble that you like best? Because I find that hobbling can be very tricky, right? Especially with the little dogs, right? Little dogs are close to the ground. It could be hard to hobble.
Yeah. My go-to has been the dog legs. Those are the hobbles that I tend to go to. It can be a little bit intimidating to put on at first, but once you get used to them, I'm a big fan.
We actually did an interview in December of 2023 with Ben Bleccia from Doglegs, and we talked about his shoulder stabilization system. So if you're interested in learning more, go back and take a listen to that show.
It is a device that can be taken on and off. It's Velcro.
Yes.
I remember when I started in this field decades ago, and I don't even know if I knew the term hobble. So basically, if I'm describing it right, it's basically a tether that goes between the limbs. It can be in the back legs or the front legs, but it limits motion and doesn't allow, the limb to splay out and maybe cause further injury or allow enough time for healing to occur without re-injuring. A lot of times in the hospitals where I was working, they were using tape and various inert, what would I want to call that? Binding materials to hobble the dog's legs. But there are products out there that are much more comfortable, can be taken on and off, and certainly much gentler on the skin.
Yeah, yeah. And it was complete immobility, right? So early on, it was, if there was, well, an MSI is a relatively newer pathology that's been diagnosed. But the beauty of these dog legs is exactly that. You can take them on and off. The point is to limit abduction, or that splaying out that you talked about, to avoid re-injuring that medial joint capsule within the shoulder itself. The hard part is, as we discussed, it can be one of those devices that causes more harm than good. So it also limits sagittal plane motion, or just forward
Front
motion,
to back.
flexion. Yeah. Yes, exactly. The flexion and then the extension. So it limits not just the abduction or the splaying, but all planes of motion. And that's why we have to be really cautious with it.
Well, we've covered the shoulder. How about we move on to the elbow?
Yeah, elbows. Don't we all love the elbow? Yeah. It's a very, very complicated weight-bearing joint. And that's the biggest difference in dogs versus people, right? So they weight bear, we don't. One of the primary issues I would say with elbows are typically arthritis, right? As puppies grow and develop, they can have all kinds of developmental dysfunction within those elbows, coronoids, that sort of thing, and arthritis tends to set in. The beauty with an orthosis is to be able to take the stress off the joint and spread it out above and below. So an elbow orthotic device for dogs is pretty rare. I've done in 26 years, probably, maybe one or two. Same with tarsal orthosis for the hock, for arthritis specifically. It's just a more complicated joint in a dog, but if we can consider that, I think it's a wide open field to pursue more aggressively that we can get better outcomes with. So it's not something that's really thought about up front for elbow OA that I think is a real missing piece in this field. I think we can do a lot more good with elbow osteoarthritis in the use of an orthotic device. The Hero braces can do an elbow orthosis for OA. Again, it's rare, but I think it's a wide open area that we owe our dogs a little bit more understanding and, not necessarily research, just clinical experience, what works and what doesn't. It's a relatively, easy device to make. It's just a matter of motion and being able to limit motion within mid-range so it doesn't cause discomfort for the animal, and it can be cumbersome. So the small dogs probably wouldn't work. You've got to have some leg there, if you will, in order to support above and below. So it's not for every animal, for sure.
We haven't really talked about this, but how important is getting accurate measurements or testing?
Yeah. And there's some companies that were out there where you lay the dog down or you have to sedate it and you have to wrap saran wrap and then you have to mark 25 million, anatomical points. And honestly, that's part of why I love the Hero braces. I can cast the leg and send the cast off and it's done. There's some specific instructions for sure. When you're casting, it has to be a good cast in order to really give a good representation of the limb itself. It's a very, very easy casting process. I used to cast within a 30-minute period of time, an appointment time. I would have the owners help me. And I would have, one of the technicians help and hold some of the casting material as I wrapped. If you can put a bandage on a dog, you can cast a dog. This is one of the most intimidating points, I think, when people consider doing orthotics in veterinary patients. This is, I think, the biggest, most intimidating factor of why they don't, because they're afraid of the process. And you guys are so used to bandaging these patients. That's really all it is.
Well, and I remember asking veterinarians that, I was close to and collaborated with, and if they would help, in a casting process, or if I could send patients to them. And I was turned down by every single one of them because I think that intimidation, that fear, and also like thinking there are no do-overs, right? Like you have one shot to do this cast. Whereas if I put on a bandage and I don't like it, it ends up being, I don't know, too tight or wonky, I can take it off and I can do it again.
Same as a bandage. If it's no good, you start over. I can't tell you how many times I've done that. Or the patient moves, or it just doesn't dry correctly. Or, you know what, I didn't overlap by 50%. So there is a technique to it. And certainly with carpal and tarsal braces, you have to get the toes in there with the extension. And that's really important to give them as normal of a standing position as possible. And that's not always the most comfortable, for the patient. So it is a technique just like anything else. And once you get it, boom, 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 we're done.
But they give you enough materials that if you needed to do it again, you could potentially.
Oh, for sure. And they'll send a casting kit. They send a full casting kit, and they've got casting videos online. And honestly, again, once you get used to it, it's no big deal. And the clients love to be involved, and the dogs love that their owners are there, petting their head. And I don't sedate, right? I don't, my stupid joke is I don't do drugs, so I don't want to have to take, I know it's so dumb, but I don't want to have to take the time to sedate. The owners don't want me to sedate. I can lay the dog down. It's extremely rare that I have to sedate a dog for an orthosis.
Carrie, I wanted to ask you about what you said in the beginning, maybe not a true orthosis, but a sleeve of sorts. Oftentimes they're neoprene, elasticized, Velcro. When it comes to elbow OA or any joint that has arthritis, osteoarthritis, do you feel that there can be benefit in using that type of thing that isn't limiting motion, but is providing, again, proprioceptive feedback, but more so maybe a neutral warmth to help with stiffness, maybe a little bit of support in the way that they may move because of that feedback, and they're not going to go maybe cuckoo nuts. I was just thinking about that for the elbow in particular.
Well, so for just talking about the elbow, I think for sure there's definitely some dogs where the proprioceptive input is probably the best benefit of those neoprene sleeves. But do know that it's zero support from a joint standpoint. It is not taking away stress or pressure on the elbow joint itself. The other biggest concern with those as to why I've never used them, and this goes the same for the knee as well as the elbow. If you look at normal standing angle, we have a certain degree of flexion, right? And it's going to bunch up into the crook of the elbow, right? So how comfortable, how functional are those truly? And if we look at the knee as well, people want to use those for an MPL or a medial patellar or lateral patellar luxation. It does zero for the mechanics to stabilize that patella. And it's very, very difficult to keep on because of the bunching on one side of the dog's body.
Well, and I can attest to this. I am using an elastic sleeve, if you will, on my knee in advance of my total knee replacement later this month. And I only wear it when I'm doing higher level activity because I think the compression helps to control my extreme swelling that I have. But you're right, Carrie, it gets really uncomfortable behind my knee. And I can't wait to take that thing off, when I get home and can put my leg up and so forth.
You're not going to get the compression in a dog elbow or a dog stifle because of the angulated standing position. It's just not going to happen. And you're not going to get full, compression around the circumference of the joint, period.
Let's move on to my second least favorite complicated joint, the dog's carpus.
Oh, these are my favorite. Really? Oh, I love these.
I think the most common thing we see that needs orthosis or some type of bracing is carpal hyperextension injury. Can you talk a little bit more about that?
For sure. These are one of the common joints that I mentioned that we use orthotic devices for. The hyperextension injuries, most often a dog has jumped off second story building, whatever it may be, jumped into a ditch and caused stretching, if you will, of those flexor tendons. And if you think about a dog and how they stand, it's called digitigrade, meaning they stand on their digits. So any number of strengthening exercises, any number of physical therapy treatments that you do are never going to allow those that carpus to come back to a digitigrade normal standing position, which is why I am a huge proponent of orthoses in this condition. I've done bilateral. I've had dogs that have dropped on both front limbs, and we get a hyperextension, and it looks as if they're literally standing, on the flat of their foot. It's awful to look at. It just makes me cringe. It's just not normal. And so I'm a big proponent of the use of orthoses in these dogs. And here again is, real specific type of casting procedure, just because we want to be able to get that dog up into a normal standing position, which means we have to angle that foot into extension in a normal position. And oftentimes that proximal, that distal row of carpal bones can be injured. So it's really important for your rehab professional, for your physical therapist to evaluate what passive normal range is, after injury, to make sure that they can comfortably get back into that standing position before we cast.
See it a lot in my senior patients too, Carrie. I don't know that they've had a specific injury or not, but I have an Airedale right now who's bilateral carpal hyperextension. And I'm wondering if these dogs are even a good candidate for some of those wraps that you see. Some of the sporting people use them for prevention of injury. What do you think about that?
Big fan of those too. And I am a big fan of the TheraPaw carpal wraps, because you can specify the degree and level of rigidity that you need. And I actually had a patient with IMPA, or immune-mediated polyarthritis, and she was down in all four limbs, flat-footed, plantigrade, if you will, meaning, literally walking on the flat of her paws in all four limbs. And we use the TheraPaw to get her upright into a more normal standing position. So those soft splints, those soft braces, can be customized with TheraPaw to support and hold those dogs upright, especially in the older patients, like you said. Sometimes with weakness, the high temperature thermoplastic orthoses can be a little bit more cumbersome, and they're not athletes, right? Let's be honest. They're maybe walking around the yard, and for the most part, they're laying around the house. It's a great option for those patients as well.
So just to clarify, you're a big fan of these wrist orthoses and or soft supports, dependent on the situation. And it could be one side, unilateral or bilateral, depending on if it's traumatic or maybe more of an insidious onset, through breakdown with fighting gravity. We're all fighting gravity as we age, but there is a place for these in various types of patients who end up in this predicament.
Yeah, and a lot of the internal medicine issues, right? Now, let's make sure we differentiate that from wearing these carpal tarsal soft braces for quote unquote prevention of injury. I'm not there. I'm not so sure I believe that's the case. And it's purely anatomical. let's take the carpal splints or carpal braces, for example. If you look at normal standing position of a dog's front limb, those metacarpals are dome shaped. That allows for more medial lateral motion. And just take our agility patients, for example. They come off of an obstacle, they hit the ground, and they turn quickly. What are these carpal braces doing? What is the purpose of these carpal braces is my question. And are they actually hindering normal motion that's causing injury elsewhere? So until I see a little bit more detailed evidence for these, I don't recommend any type of tarsal carpal support in canine athletes.
Even after they've had an injury, or only preventatively?
Well, tell me the injury. So here's our real specific, individualized case. And even after injury, what kind of injury is it? What are we doing putting these carpal tarsal soft splints on? What is the point? What is the purpose of these?
And if they're rigid, I mean, they can't flex their wrist.
Well, and it's limiting motion, right? Yeah. So the joints above and below are what's taking the brunt of that force. Exactly. And you think about the front limb, especially the carpal, the carpal joints, and the thoracic is your braking, and that's your impact. So if I'm making that carpus rigid, where is that force going? Most likely right up the chain, right? So are we getting increased elbow force, increased, shoulder forces? I never ever recommend those in whether it's a quote unquote prevention.
Yeah, because I was thinking, like, what if they had a medial or lateral collateral ligament injury and they were in a soft splint, but like you were talking about therapos, so we can add some rigidity in the form of strapping to limit that excess motion in that side to side plane, still allow them to function front to back in the sagittal plane for the most part. Would something like that be advantageous, or you're just black and white?
Are you competing? I'm or trying. Is this during physical therapy?
Oh, I thought you meant, am I competing with you? Yes, I'm competing with you, and I'm debating. I'm debating this point.
No. Are these patients competing? Are you putting them in it, as a way to protect and putting them back into sport? So I would argue, and I would challenge that perhaps they're not. If those medial lateral ligaments aren't stable enough, should they be going back to sport?
Right. Shouldn't be competing.
Yeah.
And I guess I was thinking sometimes they use it during their training, and there's a graduation of training from easier, shorter bar heights and things like that to, more faster speeds, higher bars, maybe they don't do weaves initially, and then they have to get back to weaves. So then taking them off for actual competition, but as a means to an end. So ostensibly they're sound. Again, how do we can never mimic those forces in the clinic and manually challenge to the degree that they can in terms of using those limbs in weight bearing with velocity and their own bodies, right?
This is great because, I use an orthotic, and we'll get to the tarsus, especially for Achilles tendon and Achilles tendon repairs. So it's sort of along those lines. And I certainly, progress my patients in the orthotic device and then graduate, like you said. My concern with that carpus is if they, what are we truly supporting it? Number one, I question the validity of those carpal soft splints to truly limit that tiny intrinsic motion and the medial lateral instability there. I question whether they can truly do that.
Yep.
Right. So how valid are they? And what are they doing to all those tiny little ligaments that allow a degenerate stance? Right. So if they're limiting medial lateral motion, they're doing it for all of it, not just specifically where you want it. You can't control that. And where is that force being taken? So think about tendon ligament healing, right? So we want stress We want natural stress on those tendons and ligaments. It just takes longer because of the poor blood supply. But we also have basic science physiology evidence that stress on tendons and ligaments helps them heal. So as long as you're progressing your therapeutic exercise appropriately, do we really need that?
Exactly. Yeah. And I was thinking like just keeping them out of those extreme, that preventing, well, like what if they slip, like there's
well, they probably shouldn't be training that hard at that stage.
So like there's water on the floor and they slip and then they, and they've had a history of injury, but yeah. Okay. Let's move on. Moving on.
Yeah. It's a great topic. I love it. I love
had a
it.
whole show on that. Just that.
We could.
All right. So let's move on to the back end then. Let's talk about hip bracing. What do we have to say about that?
Oh, yeah. Again, I think it's kind of like shoulder. The more proximal you get, towards the core of the body, the softer these supports get because you've got so much going on there. No real high temperature thermoplastic type of orthotic device that's available, like for hip dysplasia, for example. What I do use and what I am a big fan of is the sensory input, like the hip line garment from Canine Motion. Most of that is reducing pain, correcting posture, trying to activate the most appropriate musculature to improve that dynamic stability in dogs with hip dysplasia and hip OA. It was designed by a physical therapist who has a very deep understanding of all of that neuromuscular control. So, that's one of the soft splints, if you will, of what I would encourage people to use for that. It's a pretty neat, well-designed device. And I've got some cool videos of a dog that has some hindlimb weakness as well as hip dysplasia. And if you think about a dog with hip dysplasia, the biggest avoidance is hip extension. That's what hurts. So often these dogs are tucked. They have a flexed posture, a tucked pelvis, which often causes lumbar pain then secondarily. They lose function and extension within their thoracolumbar spine. They lose function in their hip joints as well. So putting on these hip lines allows for that corrected posture and activation of the more appropriate musculature to maintain strength and joint control during movement. I have some really great videos that demonstrate some of these soft splints, and we'll get into postural stability as well. And that's what this particular garment, the hip line, does.
For our listeners, you're going to want to go to our YouTube channel to watch these videos. So go to Petability on YouTube and you can see these videos.
I'll show you another postural garment, the Wiggleless back brace, and we'll talk about that. This first one is a case of an older dog. As you can see, there's a lot of ataxia, a lot of pelvic limb weakness, and you see that short, choppy stride where the dog is attempting to avoid extension. Versus here, you see a lot more control in the pelvic limbs with the dog wearing this hip line postural garment, allowing that animal to participate in daily activities.
Was pretty impressive. And this dog has hip dysplasia, Carrie?
Yes, as well as some obviously neurologic, probably multifocal disc, right? That we see so often in our older patients. Right. With disc disease, they have a neurologic disease as well as hip dysplasia, and you can see a pretty dramatic difference in the stabilization.
Very
and
dramatic.
Look, he wants to play. Yeah.
He's going to engage in the things that bring him joy.
Aww.
Exactly.
When I was watching, I was also struck by just the amount of energy expended to try to stay upright. Right.
Exactly.
Let alone moving, forward. So all those muscles and supportive structures that are getting stressed with that excessive movement side to side and fighting gravity. And I mean, just think about how tiring that is. So not only, is the device helping him to do the things he loves, but to help him do them longer because he's not worn out by just trying to negotiate his environment.
Yeah. So not only, the expenditure, but what about the potential for injury? If we've already got neurologic disease, are we contributing with that side to side motion? And often those dogs are falling over, right? We get a torsion, we get a twist in the spine. Is that contributing to, some of the spinal disease that they already have?
Absolutely.
I think that there's a whole emotional piece here, like Chris said, alluded to earlier. These dogs are conditioned to predict that fall, and that weighs heavy on their whether they're going to decide to move from the living room to the kitchen because they predicted a fall, right? And how much better can you imagine that same dog with this type of support and the choices that dog would be able to make, right?
I'm a huge fan of all of these devices, but again, know when to use them, right? It can be overstimulating, and we'll talk a little bit more about that, especially in dogs with DM, because of the regression of neurologic disease. And if things change, we've got to be able to stay involved to monitor this. And at what point does it become overstimulating and the dog's not going to go at all? So, for example, in this particular case of Myhan, this is a patient of mine that has degenerative myelopathy, shepherd mix. And her family absolutely adored her and wanted to, they're super active here in Colorado, and they wanted to keep her going. And Myhan, this is the early stages of degenerative myelopathy. And you see here again, very similar to a bear that you saw in the first video with the hip line garment. This is not hip dysplasia. This is a degenerative neurologic disease. And you see the toe protection. You see, just that ataxia and how severe it is. Here's Myhan with the support of that wiggleus, and look how much more stable.
Wow.
Look at that direct motion.
It's amazing.
And here again, playing, right? Playing with the toys that she wants to be playing with. Now, there was a point with Myhan that we had to get rid of that wiggleus because the trunk stability overpowered what motion she had as she continued to regress. And at that point, we ended up doing a Dog on Wheels cart for her. Jenny Moe owns Dog on Wheels. She's a physical therapist as well. And we worked with Jenny to get her out of this wiggleus support and maintain her independence using a Dog on Wheels cart. Very cool. Yeah. So those are the hip, the trunk stability garments that I am a big fan of.
Well, ladies, we have covered so much here today in this show. We talked about the shoulder, the elbow, the carpus. We talked about the hip and trunk. We still have so much to delve into with the knee and the tarsal joint. So I think this needs to be a 2-part series. We'll be coming up with our next episode with Carrie Adrian, and the topic will be orthosis for the knee and the tarsal joint. So stay tuned.
Is there anything, Carrie, that you want to leave the listeners with? A particular message, last thought about using an orthosis on canines?
Yeah, I think the thing to leave everyone with is this is a viable option, for patients. And for all the rehab professionals out there, don't let it be intimidating. It's just like anything else in our field. Once we learn it, it becomes second nature, being able to cast for these, and extremely beneficial for our patients, and provides an alternative, often an alternative to surgery. So, certainly happy to answer questions and, talk about cases and, reach out, happy to help where I can.
Can they find you, Carrie?
Yeah, the Canine IQ is my business that does educational training. It's my platform. So info at Canine IQ, CANINEIQ.net is the best place to reach me.
Excellent.
Awesome.
Excellent. Thank you, Carrie. It's always great to talk with you. I learned so much today.
Thank you, ladies, for this opportunity. And again, let's do it again soon.
All right. Thanks, Carrie. You're the best.
Thanks, Carrie.
Thanks, all. Ditto. Take care. Bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you and tune in next time.